Hello, my name is Destiny Khoshaba, and today is April 18th, 2022. I will be presenting to you my case presentation on anemia iron deficiency. Typical patient presentation. A 24-year-old female presents to her physician with extreme fatigue, weakness, lightheadedness, and brittle or concaved nails. She notes that she started a vegan diet about 6 months ago and notices that her menses are particularly heavy. Upon examination of her tongue, the doctor noticed glossitis. The etiology of the disease, or the underlying cause, is shortage of iron in the body. This is due to lack of iron intake, lack of iron absorption. Diseases and surgeries include atrophic gastritis, post-gastrectomy, celiac disease. Other associated conditions are inflammatory bowel disease, peptic ulcer disease, and other GI tract diseases. Also, an increased demand for iron. An example is due to menstrual blood loss. Going back to inflammatory bowel disease, the inflammation that is caused in your digestive tract leads to a decreased ability for your body to absorb iron, and the inflammation will also lead to a significant amount of blood loss, as well as the menstrual blood loss, and this increases the demand for iron in your body. Background information. The importance of iron for the production of red blood cells is hemoglobin. Red blood cells need hemoglobin in order to transport oxygen throughout the body, and the hemoglobin requires iron to build a component of it, which is the heme part of hemoglobin. And without iron, hemoglobin production for red blood cells is decreased. I noted the definition of hemoglobin and myoglobin. Hemoglobin is a protein in the red blood cells that carries oxygen throughout the body. Myoglobin, a protein that provides oxygen to the muscles. And if someone does not get enough iron in their diet, the body cannot produce enough red blood cells, and then the cells will lack hemoglobin. Another important fact to note is how common anemia iron deficiency is. It's actually very common. There's more than 3 billion US cases per year. And a little history fact I added here is the discovery of iron deficiency anemia in 1852 by Carl Virchow and his student H. Welcher. Risk factors include all ages, most commonly toddlers, pregnant women, and menstruating women. Predominantly it's in females due to the menstruation and the blood loss. Also being a vegan. Usually a lot of iron is found in animal-derived foods. So that is the cause of anemia for having a vegan diet. Also intestinal disorders like Crohn's disease and celiac disease, being a frequent blood donor, family history, and chronic conditions that include cancer or kidney failure. For cancer, it can be due to the kind of cancer the person has or the chemotherapy that they're going through causing the anemia. And for kidney failure, the kidneys produce the hormone erythropoietin. And in order to make red blood cells, the body needs a pretty good supply of erythropoietin. And if your kidney is failing, then there's a significant reduced kidney function, and there will be a drop in your red blood cell count, which will in turn develop anemia. It's important to understand these key topics in order to fully understand the pathophysiology of iron deficiency anemia. So, like we discussed, insufficient dietary intake, like the vegan diet, chronic blood loss, like irritable bowel disease, metabolic or functional hemoglobin synthesis, metabolic disorders, insufficient iron delivery to bone marrow, impaired iron use within the marrow. And your bone marrow needs iron in order to make hemoglobin. Without enough iron, the body won't be able to produce hemoglobin. So without that iron, anemia will occur, and it's very important for your bone marrow to produce healthy red blood cells and to produce that hemoglobin so that oxygen can spread throughout the whole body. Here is a zoomed in picture of the red blood cell, and inside the red blood cell contains the hemoglobin. As you can see to the left, that kind of coiled molecule. The main function of the hemoglobin is to bind to oxygen and to make the red blood cell into an oxygen transporter so that all of our tissues can get oxygen. The 4 blue dots that you see to the left in that red circle contain iron, and the iron molecules is what binds to the oxygen. And as we mentioned previously, iron and the protein myoglobin is significant in this case because of transporting oxygen to the muscles. Another protein mentioned here is cytochrome oxidase, and it creates ATP. Overall, this picture is great at summarizing how important the function of iron is to the red blood cell and the significance of heme binding to iron in order to effectively transport oxygen to all of the tissues. Lack of iron reduces hemoglobin synthesis. The bone marrow will produce microcytic or smaller red blood cells and will decrease the amount of reticulate count and hemoglobin production. Microcytic red blood cells leads to hypoxia. The decreased oxygen in the tissues is due to the lack of the red blood cell production, and the bone marrow will try and increase that red blood cell production. However, the bone marrow will produce incomplete red blood cells called poikilocytosis, which is the increase in abnormally shaped red blood cells, and anisocytosis, which is different sizes of red blood cells. As we touched on before, hemoglobin is necessary for the body because of oxygen, and hemoglobin being the protein in the red blood cells that carries the oxygen to all of the body's organs and tissues, it's highly essential. As I noted here, iron is recycled in the body, iron is stored in the body, in the cells, in the blood, and when patients are experiencing fatigue, weakness, cold hands and feet, menses being heavy, the symptoms all root from blood loss, the decrease in the storage of iron. And the big takeaway is the lost blood causing these symptoms. A recap of the pathophysiology comes in 3 stages. First, storage for iron for red blood cell production and hemoglobin synthesis being lost or decreased. Number 2, production of decreased amounts of iron travels to the bone marrow. The low iron equals the decreased hemoglobin synthesis. Number 3, bone marrow releases hemoglobin deficient red blood cells into the circulatory system, and then lack of iron supply and hemoglobin synthesis occurs. Normally, symptoms appear in stage 3 because that's where all of the iron deficient red blood cells are entering the circulatory system, and fatigue, weakness, cold hands and feet, all of those symptoms will appear. These symptoms are asymptomatic in most cases. However, the most common is fatigue, headaches, dizziness, weakness or lightheadedness, chest pain, tachycardia, cold hands and feet, paler skin or pale skin, glossitis, which is a swollen and inflamed tongue, Koilonychia, which is soft nail beds or the scooped appearance. As you can see from the patient presentation, she did complain about brittle or concave nails, shortness of breath, and pica, which is a craving of and chewing of something with no nutritional value. For example, some patients will crave chewing on ice. The symptoms all here connect to the main issue of iron deficiency anemia, which is the lack of iron and the need for the protein hemoglobin, because our body needs that oxygen to be transported throughout the tissues. Without iron binding to heme, we won't be able to get that oxygen to transport throughout the body. Here are the different diagnoses used to diagnose somebody with iron deficiency anemia. First, we'll start with the left side with the labs, and these are all blood tests that are used. First is hemoglobin, and I listed the normal ranges here. Normally, the ballpark is 15 grams per deciliter. The hematocrit is also a blood test used, and I listed the normal levels for the genders, and the ballpark is 45% of volume of red blood cells in the serum. Next is the total iron binding capacity, or TIBC. If a person has high levels, they are iron deficient. Also, the peripheral blood smear, which is a sample of blood viewed under a microscope that counts different circulating blood cells like red blood cells, white blood cells, platelets, etc. Next is mean corpuscular volume, or MCV. Low volume of red blood cells means microcytosis, which means iron deficient. Lastly, ferritin, which is a form of iron. If a person has low levels, they are iron deficient. Other diagnostic tests include endoscopy, which will show any upper GI diseases or any upper GI bleeding, colonoscopy, any lower GI bleeding, stool occult blood testing, which will also show any gastrointestinal bleeding. Lastly, ultrasound of the pelvis, and that's for women. It shows any uterine fibroids, which will indicate any menstrual bleeding. For treatments, it's very important to first figure out the underlying cause in order to properly treat. So as we discussed with the diagnoses and to see what's going on, is it a GI problem? Is it menstrual bleeding? Is it something to do with the person's hemoglobin? What is it? So for treatments, there's iron supplements or ferrous sulfate. Many people take iron tablets, and it's better to take it on an empty stomach because your body will be able to absorb it better. However, a lot of people experience stomach pain when doing that, so your doctor may advise you to take it with food. A tip is not to mix with antacids because it will neutralize the stomach acid and decrease the ability of absorption of the iron. And vitamin C is known to increase iron absorption, so your doctor may encourage you to drink like orange juice with your supplement. Something that's rarely done is IV iron if patient can't tolerate the iron orally. And in severe cases, a blood transfusion is needed. The main goal here is to increase levels of iron in order to increase the hemoglobin in the body.